Robert, how are you doing today?
Good, Erica.
Come in, have a seat. We're just going to be talking a little bit more in detail about our last meeting, and just to follow up to see how detox went, and see if there's any questions for me before you go into your treatment for 90 days. So I just wanted to see how you're doing as far as, how you're feeling physically, and just how you're doing after your detox.
I'm doing pretty good. I feel 100 times better. I still have some cravings, but I'm managing. But I feel a lot better.
Good. And that's normal. I don't know if you've ever gone through detox before, and throughout recovery, you're probably going to have cravings, and that's just one of those things that you're going to have to learn how to deal with, and learn what your triggers are, and what your limit is. And now, how are you feeling emotionally?
Well, I thought about my mom more than I have in the past, since she's passed away, and I cried for a whole day straight yesterday. Not sure if it's going through withdrawal from the drugs, or I'm just allowing myself to feel grief for my mom, but it was a tough day.
It was a tough day. Okay. And that you might have a couple more days that are going to be like that. The grieving process is hard, and sometimes when you postpone the grieving process, you don't allow yourself to grieve, it actually can become harder, because you push those feelings down, and once they start to come up, they're a little bit tougher to deal with. And also, once you get out of treatment, that might be a trigger for you, so that's something that you will have to look out for, just when those feelings come up, because you associate your mother's death with the drugs, since you've been using to cope with your mother's death. So that could very well be a trigger for you. So that's something that you're also going to have to look out for. And when you are in that grieving process, you might have to reach out and get some help during that period. Now, I know before we met, when we met last time, you stated, you felt a little hopeless, and you felt, you definitely felt some hopelessness after your mother's death, because you were so close to her, and she was all you had, you stated before. Now, how are you feeling as of right now?
Well, I'm not feeling hopeless. I'm feeling hopeful. Second night I was in detox, I had a dream of my mom, and she was telling me I was going to be okay, and she was with me, and I'll make it through it.
Oh, that's awesome. And I believe with the right kind of treatment, in the right facility, and with the right support, you will definitely make it through this process. And now, as far as your father, have you thought about that, or is that still just something you're, and that's going to also take some time.
Yeah, it's going to take time for me to forgive him, but I think now more that I'm clear and not on the drugs, that I might be able to actually forgive him.
Okay, that's good. And sometimes, the drugs will intensify your feelings. So if you're feeling feelings of anger towards him, the drugs can intensify that. So it can almost turn it into rage. So coping with those, and again, when you're in recovery, it's all about triggers, and learning your triggers. And we're going to be talking a lot about triggers throughout the process and throughout the 90 days. So that's going to be, again, a big thing. Now, as far as, have you talked to any family members about moving your furniture, or have you had any time to decide on that? I mean, that's some phone calls that we can help you with, and,
I got a few friends I think could probably help me take care of that. I don't have much anyway, so
okay.
it should be not a problem.
Well, as long as we can get your clothes, the things that you know, do value, and we can try to set it up to where you can get maybe even a storage unit, with there are some programs that are available to you, and I will give you a list of those programs that just will assist you during the time that you're in treatment. These type of programs can help you even pay like certain bills, because you're not going to be working while you're in treatment. And then also, you know, just maybe even helping you pay a storage unit or something like that. But we'll look into some of the programs and see what's available for you. And I know you said before that you weren't working for at least 3 months, so you know, we'll definitely look into that, and you could probably qualify for something like that. Now, also, I was thinking about, as far as setting you up with a counselor within the treatment facility, I will be your counselor outside of the facility, but you will have certain counselors. And I just wanted to know if you would prefer a female or a male counselor, if you had a preference on that.
No, I don't think it really matters. I can talk to either one.
Okay. Now, I was reading in your charts, and I noticed it said that back in 2008, and this was before your mother passed away, you were on medication you had some depression back then, and it looks like you were on a low dose of Prozac. Are you still currently taking the Prozac?
No, I got that prescription ran out, and I really never renewed it. And I wanted more, and they couldn't give me anything stronger, so that's why I kind of really went into other stuff.
Okay, so that's something that we'll set you up with one of our psychiatrists that can prescribe some medication for you. They'll look into it a little bit more, and we'll try to figure out the right medication for you, and see if there is some underlying depression still there, and you know, try to get your prescription filled, or try to figure out what medication is going to be right for you. And you know, while you're in here, and then again, I can find, you know, because you're not employed, we can try to find some kind of program that can help you with your prescriptions. Or did you say before that you were a veteran?
Yes.
Okay. No, actually, we could probably, what I'll do is I will call the VA, and we can see what we can do. We'll try to make some connections and see exactly what we can do, and see there if, you know, they will take care of your medication. Are you getting veterans benefits, or?
No, I haven't.
Okay, so we definitely want to take advantage of that. You know, that will definitely be in your favor, and VA should cover a large portion of it. And I believe also they just started a new program for veterans. It's a drug and alcohol treatment, but it's outpatient treatment. So that would be a great program for you after you get out of the 90-day treatment. And we could possibly even see if they would cover the cost of your 90-day treatment. And I'll look into that more. So, now as far as, do you have any questions for me about the facility, or anything, any questions that I can answer for you?
No, I'm just ready to get better.
Okay.
Hopefully they can help me.
That's awesome. That is a great attitude to have, and I'm really happy for you, and I really think that you are going to do well. if you will just listen to your counselors, they know what they're talking about, and, just go through the process and just walk through it and be open to things. And it seems like you're very open, and you just have to be really open and be open to the recovery process, and you have the grieving process. There's some things that need to be healed for you to, for you to get better. So, just a little bit about what we've talked about so far today. And I was just asking you how your detox went, and, how you were feeling. And you said that you were feeling pretty good. Is that correct?
Mm.
After, as far as physically, you're feeling pretty good. There's no sickness or anything.
No, just a little bit of depression, but I'm okay.
Okay. So, but you said that you did say that you were feeling more hopeful, and you said you had a dream about your mother, and that's just so awesome that you were able to have that vision, and then we also talked about just your apartment situation, trying to get that situated, and then also the medication, and hooking up with programs that we can try to take advantage of every program possible for you, as far as financially, and as far as having the VA cover some of your medication, things like that. So, would you say all that is correct?
Yes.
Okay, great. So what we're going to do is I am going to release you from detox. I'm going to have to get one of the MDs to sign off on this. And then we will actually have a van drive you over to the treatment facility where you're going to be staying. It's actually really nice. It's right on the beach. I think you're really going to enjoy it. It's top notch, and they have some of the best counselors there. And I'm going to put you with Dr. Benson. He's one of the psychiatrists there, and he will get you started looking, and he'll be looking into the medication and things, and maybe looking into a proper diagnosis for you. And then he will assign you to a counselor there. And if for some reason that's not the counselor for you, you can always switch counselors. There's no hard feelings. And so what we'll do is we'll just send you over there by the van, and if you need anything, you can call me at any time. I will be making all the arrangements for you, and assigning programs and stuff for you. Okay? Do you have any questions for me as of right now?
No, I think I'm good. I'm just ready to go.
Good. That's a great attitude. Well, again, Robert, it's been a pleasure to see you again. And of course, I'm going to be seeing you pretty soon, and I'll be checking in on you periodically while you're in treatment. And again, if you have any questions, please call me. Okay?
Okay.
Okay, great.
Thank you, Erica.
Thanks, Robert. You have a great day.
Thanks.